I'm Danielle Good. I'm a senior research associate at Comagine Health. I'm here today to talk about the UCOPE project and give some updates on that project. UCOPE stands for Umatilla County and Community Outreach, Prevention, and Engagement. And Comagine provides facilitation and implementation support for this work. And we also do data collection and evaluation, but I really want to highlight and bring forward the folks who are really doing the work in Umatilla County. So if Mariah and Janine want to say hi before we get into it.
Yeah, I'm Mariah Wright. I am the Prime Plus Peer Supervisor here at COPES over in Umatilla County.
Hello, everyone again, and I'm Janine Hernandez. I am a certified clinical medical assistant as well as our UCOPE mobile clinic program manager.
And we're so excited to be here today and to share what's going on in Umatilla. So I'm going to start with just a project overview, talking about how UCOPE is structured and some of our goals. And then we're going to spend a good chunk of time with Mariah and Janine talking about implementation, some of the parts of this project, what's going on in the community. And then we'll celebrate successes and talk about some of the challenges that the work still faces. And then also questions, of course. So I'll start with a project overview. At the very beginning of this work, which started 3 years ago, we developed our project mission and vision statement, and that was to develop a collaborative team of local partners, including people who use drugs, to coordinate and implement a comprehensive package of interventions using a harm reduction framework to improve healthcare access and outcomes for people who use drugs in Umatilla County. And so our hope was that this project would lead to increased access to high coverage syringe service programs. When we started the work, the syringe service program in Umatilla was virtually brand new and didn't have a ton of reach. So it's been so exciting to see that develop over the last couple of years in Umatilla. Increased linkage to substance use disorder treatment services, including medications for opioid use disorder. So part of what we've been discussing in this project over the last couple of years are some of the settings and sites where we really need to see increased access to MOUD in order to have the greatest impact on the community in Umatilla. Increased hepatitis C, HIV, and hepatitis B testing amongst people who inject drugs. Increased linkage to treatment for infectious complications from HIV, Hep C, Hep B, bacterial and fungal infections of injection drug use. And a really exciting thing that we're going to highlight today is the mobile services that are expanding in Umatilla, and wound care is part of those mobile services related to that. And then the increase of hepatitis A and B vaccines amongst people who use drugs. So this project is funded by CDC. And we have our core project team, so Oregon Washington Health Network, our local partners in Umatilla. Our leaders, OHA, so Shannon O'Brien and Ann Chaquin have been our great leaders for the past year. Prior to that, Ann Thomas. So shout out to all the folks who are involved in organizing and have been involved in this meeting. Of course, Comagine, we provide some of the support that I mentioned in terms of facilitation and also data collection and evaluation. And then I also wanted to note that Umatilla County Public Health has been an amazing partner in our core group. So Isabel De Vera, who's the overdose prevention coordinator in Umatilla County, comes to our core meetings. Those core meetings are bi-weekly. So that's like a really high buy-in to have some of the discussions that we're having on this project. So we're really excited that that partnership has panned out. The way the project is structured is that we have our core team, which is who I referenced on the previous page, but we also have key partners across many sectors in Umatilla. So quarterly, we have key partner meetings from a bunch of different sectors that also interact with people who use drugs. So that includes the core project team, but it also includes our syringe service provider in Umatilla County, and a bunch of other sectors that we want to have represented and that we want to be sharing what we're doing in UCOPE and also hearing from them a little bit about what they're seeing, what they're working on, what they want to know more about. So that's been a really nice space for discussion. So those key partners provide feedback and support on the work. It's the core collaborative sort of model that we have in the project. They participated in our year 1 rapid assessment. So we did a needs assessment very early on in this work to talk about what we saw as the biggest community needs in Umatilla so that we could have direction for some of the things that we plan to do going forward. They help us build connections. There's a little bit of a snowball effect. You invite key partners to a meeting. Maybe they get involved in a really good discussion and they refer us to additional key partners or say, you know, who else needs to be in this? Someone else needs to join this meeting. And so we're very open in that way. And we encourage people to join and include a lot of people on the invite for that key partner discussion. We share what we've been working on and also hear from them about what they've been working on. They provide updates and areas of connection, things that we're talking about that might be important that people see connections that we may not know about, and then champion this work in their organizations and networks. And I'll say that this has been a really cool forum for sometimes difficult discussions, or at least discussions that are not always a priority for other organizations. So bringing people together and kind of setting a tone for this is what we're going to talk about, this is what we're going to share out today and hear from y'all. It's been a really nice space to move some of those discussions forward and just hold time once a quarter to focus on these goals. So of course, UCOPE isn't happening in a vacuum. There are a bunch of other projects happening in Umatilla that also are supportive of this work. So you heard about Paths on this project, and that's also in Umatilla and a part of our mobile service offerings. Prime Plus, of course. We also have Nurture Oregon peers at OWN, so that's for pregnant and parenting people who use drugs. We're going to talk about the peer drop-in centers as kind of like infrastructurally a really important component of how access to care works in Umatilla. So those peer drop-in centers that OWN has are really important. But just to highlight what was new from UCOPE, so new funded service elements included a trailer for mobile services and then also a medical assistant for mobile services. So we're so happy to have Janine on the call, and she's going to share out about her role in all of this. All right. So I mentioned in year 1, we did a rapid assessment. We wanted to make sure that we were hearing from people who use drugs and other key partners in the community about what the community saw as major needs for folks going forward. So we had a pretty long, these were in-depth interviews, hour-long interviews. We talked to 20 people who use drugs and 20 people who provide services or engage with people who use drugs. And we asked about healthcare access, infectious disease screening, substance use disorder treatment, peer service access, harm reduction service access, and interactions with the criminal justice system. So I'll share that you all can look at the needs assessment and see what we found, but just for a little like case study of what we asked about and how we use that information. We asked people about mobile services, and at the time the trailer didn't exist, hadn't been acquired, but we wanted to hear from folks if they thought mobile services could be useful. So in talking to people who use drugs, we asked about if they had ever used mobile services, and most people had no experience with them, but they were so excited about it. This was one of the best sections of the guide because it was like a really big open-ended discussion. So it was like, okay, people are really excited. So what do you want? If we were to have a trailer and that trailer was going to be able to go throughout the county, what would you like to see offered? So that we could sort of start thinking about what would be really important to have involved in those mobile services. So people asked for naloxone and syringe services. That was really key. But they also asked for necessities. They talked about even hooking up to dental and vision as options that could work with those mobile services. And then they asked for just general support and connection to other services. So having someone who could be a mentor, having good guidance, having someone who could help them make phone calls, or just provide support while people tried to get into treatment. So it was really exciting to just hear the enthusiasm amongst people who use drugs for the mobile service offerings and to kind of set some of the parameters for what people wanted to see. But we don't end the discussion there. So this was now 2 years ago. That was in year 1 when we did this needs assessment. We brought this to our key partners and we shared this information and we shared the places that we thought the mobile services should go in the community and then asked them, well, what would you like to see? What else do you want on the mobile services? And we continue to have these discussions as we see needs come up in the community. So we keep expanding what we want the vision for the mobile services to be, starting from people who use drugs and what they wanted, and also building out what we know are some of the needs in the community. So this is one of our deliverables. I'm not going to spend a ton of time on this, but this is a logic model about how the project works, but I'll highlight a couple of things. So we had data collection in year 1 that included the interviews with local providers and people who use drugs. And then in year 3, we're actually doing more data collection. So we're going to do a little bit more surveying with people who use drugs. And also we're going to start talking about the impacts of UCOPE through ripple effect mapping. And we've developed a bunch of resources through this project that are accessible here at this QR code. So you can scan that and see more of the resources that we've developed for people. All right. Mariah, do you want to talk about the peer drop-in centers?
Yeah. So, we have 3 peer drop-in centers. They're located in Melton Freewater, Pendleton, and in Hermiston. As you guys have been told, we are harm reduction based, and we very much pride ourselves in meeting our clients where they're at. A lot of the services that we provide, the main one is we try to offer low barrier access for people who might be struggling with substance use disorder to get into detox or treatment. We also provide like a place for people to come hang out, you know, whether it's to cool down or to get warm, depending on the season, or just kind of hang out to have some company. We have coffee all the time. We have a TV, we have computer access. We also get a food share from Starbucks. So we have food all the time for them. And then we also offer a sign up for shower and laundry. And then we have a clothing closet upstairs as well. One of the main things we try to do is try to connect them with resources within our area. We're very, very close within our, like, we work really well with like our community partners, and we just try to meet the needs that they are wanting at that moment. We also run what is called like a warm line. And so what that is like people can call it for support, but we also work closely with the hospitals and the jail. So we get a lot of calls for going into the ER to visit with clients who might have OD'd or who have had history of drug use. And we try to go meet them at the hospital to try to, you know, like that harm reduction, low barrier, and meet them where they're at. And so, and we also go into the jails because we try to work with people who are getting released. As somebody with lived experience, I know the struggles of not knowing what to do when I get out, and it's hard to stay clean when you don't know where to go or have that support. And so, you know, to go in there and provide that support for the people is very, very close to a lot of our hearts here, because as I said, like a lot of our peers, as you know, like they have lived experience. And so the jails is like a big thing for us. And then I also do a thing called rounds. And so rounds is a thing I get on every morning for Umatilla County. And I guess I should have mentioned, we also have like an outpatient clinic and all that over in Union County. So I cover the rounds over in Union County as well. And I actually am pretty excited. We just got funding to get a Prime Plus peer in Union County. So I'm excited to pretty much cover that town with harm reduction. I'm like a harm reduction Nazi. So, but rounds is like, we get people who went to the hospital the day before or the night before, and they let us know who, and we get to reach out to those people. And so it's just a great resource for us to be able to connect with the clients. And yeah, I think that pretty much covers most of the peer centers anyways.
Yeah, and I'll flag that that having support for folks from the jail and in the emergency department were 2 things that we identified really early on as some of the biggest needs in the community. So exciting to hear Mariah talk to both of those.
Yeah, no, definitely. I don't know how many times, again, lived experience that when I left the hospital, because I didn't have that support or anything like that, because you also value handing out in the naloxone. And so I don't know how many times I OD'd after leaving the hospital or jail because, yeah, I didn't have those resources. Yeah. So I'm really excited to actually talk about unity within the community, because it's like a big thing. And so, unity in the community is, pretty much the gist of it is like our whole entire Umatilla County came together as a unity to better serve like our clients and people within the area. As you know, for a long time there was like that stigma, and so it gets in the way of a lot of being able to work with other community partners, or because we all have differences, right? Not everybody likes harm reduction, especially in rural areas. And so us coming together as like a unity and working with all the other organizations. At this moment, we have 36 organizations within our Umatilla County that are in this unity within the community group. And so what we do is we come together and we put on events together. And so one of the first event we did was called the Breaking the Stigma event. And so there was actually about 26, at the time it was when we first started. So there were 25 community partners at this event, and they all had their booths, and we had a big commitment board, and we had a panel of people, and it was such a good turnout. And then we also did like the dress up parade. And so we really came together and walked the parade of the streets together to let people know that like we support one another. And honestly, like all of us are there for the same thing. Like we're there to make sure that our client doesn't die. Like that's our main focus. And then, and so right now we're actually working on it's called a community appreciation dinner. And so we're actually doing on November 16th, in recognition of National Rural Health Day. And we're also doing it, kind of combining it with Thanksgiving, because we always try to do something for our clients around the holidays, knowing how hard it is to be alone and not have that human contact. And so we are putting on this huge dinner, and at the dinner we plan to have like a box where people can write their thankfuls on, or if they want to get up on the mic, they can tell people what they're thankful for. We actually found a catering service who is totally in support of what we do. They gave us a really good price because I never realized how much catering was for 150 to 200 people. And so, but they're just all about wanting to give back, which is just amazing. And so we also plan to have like a giant table with like our resources and like obviously like a big amount of Narcan because yeah, but and then we also are putting together a survey. And so I feel like this is one of the most important things that we're doing at this event, because on the survey we're going to be asking people about the barriers within the community and possibly like maybe some of the things they would like to see, or things that have been beneficial, things like that. And so, and it's cool because it's going to be coming from both sides, because this event is not just for our clients, it's for the staff as well. And so within all the communities, it's our staff and our clients, and we're there to like recognize their hard work and appreciate everything they've done. And then the last thing about is that, so this became such a big thing that now Union County has started the process of having their own unity within the community group. And so it's just spreading, and I love it.
Amazing. And we have a couple minutes, but I want to provide space for Janine to talk about the mobile services. So give us the rundown, Janine, of how the mobile services have been going.
You guys have plenty of time. You're doing great.
Thank you, Anne. Hi, guys. Okay, so let's talk about mobile services, guys. I was really excited to be able to come on board with this project. It is probably my dream job that I have been waiting for, because I have been wanting to do outreach since I started working in this field, in this department, and with our clientele. So a little bit of background on me. I have 15 years under my belt as a certified medical assistant, worked in multiple departments, including addiction medicine with our previous providers. So it is nice to go out and see our familiar faces out there. But the whole point of mobile services right now, we're really wanting to really implement paths, the hepatitis C screening and connection to treatment, of course. Thank you, Joanna, Hunter, and Kelly. You guys are amazing. And also wound care is a big one for us, because there's so much stigma, of course, within our rural communities, right, that our clients do not feel comfortable walking into an urgent care or an ER just to get examined. So if they see our mobile service out there, we're like, hey, come on over. Let's check out what we got going. Do you have anything we need to check at? Look at any wounds, any abrasions? Of course, we stay in scope of practice. So if anything does have to go to ER or urgent care, we try to go ahead and connect with the hospital or urgent cares within the area that we are working at outreach at the moment. And we do try to have a peer with the mobile clinic when we do outreach. So that way we do have that support if someone says, you know what, maybe I should go to urgent care or not. Or if they do decide they want to go to the emergency room, that way we can offer that service to them. It's been great, to be honest. We did a roundup event that was pretty successful. One of the things that we encountered, oh Lordy, no, you didn't. Sorry. One of the things that we encountered was the stigma of a lot of our clientele not wanting to go into the mobile clinic because of embarrassment reasons, personal reasons, hygiene, right? So I like to say, when you walk into my space, there's no judgment. It's a judgment-free zone. So we actually found a wound care kit that someone put on base camp. Thank you for that, because we were totally utilizing that. So if clients have something, but they don't want to walk into the clinic, they're not being left empty-handed. We have stuff to give them. So we're starting off with that, but of course, what we would love to do, the dream, is to, obviously, we would love to continue with PASS with the Hep C testing, but we also want to do all of the STI testing, continue the wound care, harm reduction services, and of course, get that connection to service whatever that client needs, right? Making it easy access to low barriers. So that way they don't feel like, oh, I have to go into this doctor's office, even though they had a bad experience. I think this has just been amazing, and we're just going to grow and bloom. Unity within the community has been great. We have student volunteers that are also involved from BMCC, nursing students, medical assistant students as well. We welcome anyone and everyone. We even have a CNA student from another county, I believe, that's also joining us. We also just did Project Community Connection with Salvation Army, and that was a great success as well. With wound care and such. So yeah, we have a bunch of other events. This coming Monday, we're going to be collaborating with Stepping Stones and EOCIL with outreach in Hermiston. So it's going to be great. But yep, guys, that's a mobile service. I am looking for other trainings. I'm not going to lie. I did get an opportunity to do the KCI institution vision navigator. So if any way in the future that we can implement that, I would love to implement whatever we can in this mobile service. So that is my dream for it.
Thank you both so much for sharing. So I'm just going to quickly share out some of the things, celebrate some successes, and talk about some of the challenges, and let Mariah and Janine contribute, as they probably are more familiar with some of this than I am. But we've had a ton of successes. One thing that we do is we try to track what we call small wins, but some of those turn into pretty big wins. So I will say that this is coming out of a list of things, that we've been tracking throughout the project. So it was really difficult to get that mobile trailer. There was not a ton of, this is the successes. I'll loop back. But anyway, so the Peer Drop-In Center's grand opening, and the amazing Sharps container that you saw in the Peer Drop-In Center photo that has the wrap that talks about peer services and has the crisis line, which is really amazing. So easy access for the Sharps container and some information for the community. That mobile trailer is wrapped. You saw it was wrapped in Spanish and in English on the other side. So that was something that we collectively talked about, needing to have really both things, and not just a translation, but a full wrap in Spanish, so that folks can view the trailer as accessible and view what's on the trailer with that language access. In our meetings, we have regular technical assistance with Harm Reduction Clearinghouse. We have some real-time collaborations that are just really exciting. So we saw a rise in syphilis cases, had that discussed on our meeting, and then problem solved in the meetings to address that really rapidly. That was a really cool thing that happened. But additionally, our key partner discussions have led to some really cool changes in the community as well. So a key partner discussion about MOUD access in hospitals and emergency departments ended up impacting the emergency department, which is putting in place an offering to induct people onto MOUD. And then, so just the general doing outreach, attending community events, not just offering harm reduction supplies, screening, and peer services, but like feeding people and just being incredibly welcoming, like you saw Janine is. So some challenges, it was really hard to get the trailer. I kind of alluded to that, but there just wasn't a lot of things that were set up to be a mobile service trailer. So it was really exciting when the trailer finally arrived and when it was wrapped. Also, staffing the trailer took some time. We're so excited that now it's staffed. Peer centers have faced some challenges, had to temporarily close and then reopen. I'm going to just highlight this one, the increased overdose instances with young people and in schools, because this we might be turning into somewhat of a success. Mariah, do you want to talk about where you have to go right after this meeting?
So it's actually, it's tomorrow.
Oh,
I got the date wrong, but yes, you know, we have a youth peer program, and so, well, a youth navigation program, and so we have a health educator and a peer youth navigator who go inside of all the schools within the Umatilla district. And so we provide education and support within the schools. And so tomorrow I get to go do a awesome Narcan training at the Athena Weston High School.
yeah, amazing. So that's one thing where we've seen connections being made in response to something really difficult that the community was facing, but we've seen some movement and welcoming in school spaces. And of course, the biggest barrier that we saw from the beginning with our needs assessment through the current moment is stigma towards people who use drugs across service sectors. And that's something that the team is constantly working around and trying to lower those barriers and lower that stigma. Yeah, I will also highlight that the mobile service trailer has gone on outreach, and it's so visible and amazing to see it in outreach spaces in Umatilla. It went to Roundup, which is a huge deal in the Pendleton area, and it did. They set it up right at the city center. So in some ways, we've seen some really cool movement where some of the community partners have been more welcoming to the services that OHM provides, and yeah. Do y'all want to say anything else about that?
Well, I did forget one point. I know that someone had said earlier that one barrier that they were experiencing was getting patients to go get their labs drawn. And that is also a barrier of ours. So being able to perform venipuncture, one of the things that we can offer is if clients do not feel comfortable going to Interpath, that we can definitely collect that blood draw if they're comfortable. I like to ask anybody, you know, are you comfortable? What's off limits? What's okay? Just so that they feel comfortable and safe in our space. And then we get that blood draw and we can get them connected to paths with Kelly. And it's just amazing that we get to provide that within our county. But I do believe there are some successes that Mariah does have that she would love to share.
Obviously we've really been trying to get our name out there. And so the other day, not yesterday, the day before that, we had somebody OD in the park next to us. And so when one of our clients who've entered here before saw the person and they weren't responding, they knew that they could come to COPE's. We're right next door, but they knew they could come here because they knew we had Narcan, and they came running asking for help with Narcan. And so we were able to and get in the mud, me and Janine did, but it was okay. It was totally worth it. We got under there and we Narcaned him. We showed up at the same time as the police and the paramedics and stuff. And so it took 3 Narcan, but he is alive. So yeah, totally grateful for that. It was a huge success. Yeah, so.
Incredible work. So I will just close out for questions. Again, this QR code is where some of the resources that we've developed for the project live. So that includes a couple of things. We have a quick fact sheet about MOUD in jails from when we were having discussions with the county jail in Umatilla. We wanted to have a resource that was just really brief and really geared towards that audience. So that's available there. The needs assessment is available there, looking at the year 1 data collection that we did. And then also the safe space checklist for providers. So thinking about lowering stigma in the community, we developed a checklist that's kind of a self-assessment tool, especially for medical providers, but it can be used in a lot of settings where it asks people sort of what they're doing already to make sure that their space is welcoming and not stigmatizing to people who use drugs. It sort of looks at the individual and then policies, and then also the space itself. So what you can do to actually make a space more welcoming for folks, and thinking about lowering barriers and providing good care. So that's available there too. Please use and distribute widely. Those resources are available for everyone. But yeah, happy to have questions.
Thank you guys. Thank you very much. There's, again, a lot of love in the chat for you all, the incredible work that you're doing, literally out there saving lives on the daily. It has been an up and down process. Yeah, the challenges of getting the mobile and then finding someone to run it, and you found the most amazing person that you could possibly have gotten. So that's absolutely incredible. I just want to ask if there's any questions for our UCOPE partners. I have a dumb question because I'm old and QR codes are new to me. Yeah, they're new to me. How do I get a hold of you guys if I'm trying to look at your QR code on my computer?
Okay, I'll put the emails back up. You can always email us. If you open up your camera and you look at the QR code, it should link. It's a link tree, so it's just a list of documents. It's a couple of PDFs from the project, so they're all listed there. I know, a huge shout out to Kin Capisser, who's not here, but is our amazing Comagine colleague who is young and also does a lot of this, but thinks of cool ways to share our work, and the QR code is one of them. So big thank you to them. They couldn't be here, but they set that QR code up. But yeah, if you scan it with your phone camera, it'll link you to the page. If not, please reach out to me, dgood@comagine.org, and I'll just email you.
Thank you for putting those back up. And again, this material will be available to folks, so you can reach out to your fellow harm reductionists across the state, and we will hopefully be supporting further communication so everybody gets to learn more from each other. Are there any questions from the viewing audience?
And I have a question.
Go for it.
So do you guys actually do treatment out of that van for Hep C or HIV or?
So out of the mobile service, we do utilize the PATS, I'll say formula. We see if they're eligible for the screening, and if so, we do go ahead and screen them. If we do happen to get a positive, we do go ahead and grab that blood draw. We haven't had to do that yet in the mobile service, but we are equipped to do so. And then once we do that, we can connect with Kelly and then get our people connected with that telehealth visit. So we are definitely using the PASS formula as it's written, and we are fully equipped to handle everything within that mobile service trailer. So yeah, we can do it.
That's great. Thank you. And I have sort of a off.
This is Joanna Cooper, and I just really love what you're doing there in your county and in your town. I know Dane, Maxine, Larry, and I, along with others, had really worked hard in Douglas County to get a trailer up and going, shower trailers. I know Dane was really working on that. And so it's just, I love seeing the community like engagement to help these folks. So great job. I love it.